So as a parent, probably one of the most common things you deal with your children are the typical cough and cold. And it's a common thing for parents to wonder, well, what can I give my child to help with cough and cold? Because it's hard as a parent to watch your child suffer, not being able to sleep, having a stuffy nose. Unfortunately, nowadays, the answer you probably get from your physician is you can't give them anything. And let's talk a little bit about why we say that nowadays. In the past, we used to give cough and cold medications to children just like we give to adults. So Robitussin DM, codeine, Dimetapp, a multitude of medications, Tylenol, cough and cold that you could buy over the counter or get a prescription for, which were meant to suppress cough. Over the years, a number of studies have been done looking at how effective these medications were in children. And in general, what we found is they're not very effective at all. Parents, when they had questionnaires done, did not report a significant decrease in their children's symptoms after taking these medications. So, of course, whenever we give a medication, we hope that we're doing something that will help. But giving a medication that doesn't help but doesn't hurt wouldn't be terrible. So why do we not give these medications? Well, the flip side is we did find that thousands of children every year were presenting to emergency rooms for accidental overdoses on these medications. Unfortunately, a lot of the over-the-counter medications don't make it clear to parents what the ingredients are, and they will have similar ingredients in multiple medications. So you might be giving your child Robitussin DM, also something with codeine that was given from your doctor's office, something that has Benadryl in the cough medicine, but also Benadryl on the side or Sudafed, and children would inadvertently be given more of this medication than they could handle, and they would end up in the emergency room with side effects. What kind of side effects can we see from these medications? Well, for medications like the DM portion of Robitussin, children can stop breathing, have seizures and coma. Same thing with codeine, children can stop breathing. And with the component like Sudafed, their heart rates can be elevated, can give them severe high blood pressure that can be dangerous, even stroke. And these are pretty significant side effects that we want to avoid. So a few years ago, the recommendation was made to stop giving cough and cold medications to children certainly under the age of 4, but even under the age of 6, related to the fact that they were not very effective and also had these significant potential for side effects. Since that time, what we've seen is a rapid decrease in the number of children presenting to emergency rooms with overdoses. So what can you do instead? Well, if your child is over 1, you can give them honey. And studies have actually been done comparing honey to placebo, which is sugar water, or honey to cough and cold medicines. And parents report a much more significant improvement in their children's sleep quality, in their symptoms of cough, with just honey on a teaspoon than they did with any actual medication or with placebo. What I usually recommend in my office is 1 teaspoon to 1 tablespoon, depending on the size of your child, of honey given 3 times a day. We think that the honey has a natural cough suppressant in it, but also that it just coats the throat and will make your child more comfortable. Of course, that's again only for children who are over a year of age. We don't give honey to children less than 1 because there are bacterial spores that can grow in honey from botulism that don't affect people over 1, but in younger children can actually lead to paralysis. So it's very important to avoid all honey products in children less than 1. Now, you may see when you go to the pharmacy honey medication, and you certainly can use this, but it's definitely no better than just buying honey in a bear, putting it on a spoon and giving it to your child. So for the kids less than 1, what can we do? Well, the important thing to know is that cough that comes from a cold, meaning cough that just comes from a little throat irritation, mucus dripping down your throat, or the natural irritation a virus can cause in the larger airways, is not dangerous and will never cause your child to stop breathing, to choke, or to have any significant side effects. And so we don't need to treat that kind of cough. Of course, if your child has a bad cough that's persisting, you want to be seen by your doctor, and they can assess if your child has something like pneumonia, if they're having asthma or bronchiolitis where they're wheezing. They can be given medications prescribed by the doctor for those specific problems that we need to treat. But again, the doctor's not giving that medication to treat the cough. They're treating the underlying condition. So if your child has a cough and small fever and a little runny nose, but is otherwise happy, active, and playful, there's nothing we need to give them because the cough itself is not dangerous. And like we just learned, the medications would be dangerous. For a stuffy nose in younger children, what we really recommend is just using the blue bulb syringe you probably got in the hospital. Some saltwater drops or saline drops can be instilled to help loosen up the mucus. And for little kids, this actually can make them feel better than anything. Little kids have very small noses, and having a stuffy nose can actually make it significantly more difficult to breathe. So just sucking out that mucus will make a huge difference. And basically, that's all we need to do for a pure upper respiratory infection or the common cold cough that goes along with it. Just watch them, a little bit of supportive care, maintain hydration with Pedialyte or other fluids, and let their bodies heal themselves.